Hi there and welcome back to the channel. If you're new here, my name is Cherrick. I'm a pediatric physical therapist. And today we're going to be doing a deep dive into a topic that worries a lot of parents but isn't talked about nearly enough. We're talking about tongue ties in babies. In this video, I'm going to walk you through what a tongue tie is, the most common signs and symptoms of a tongue tie, and some gentle exercises you can try before considering surgery, what the surgical process is, and what recovery looks like after a frenotomy, which is the surgery that you would do. So let's get into it. So what exactly is a tongue tie? A tongue tie or ankyloglossia is a condition which is present at birth where there's a thin band of tissue that's attached to the front of the tongue and is either too thick, too short, or too closed. This can restrict how well the tongue moves, which plays a big role in feeding, speech, and oral development. Some tongue ties are easy to see, especially if they're near the front or the tip of the tongue. Others may be further back in the tongue, and so they're hidden and a little bit more difficult to detect without a trained provider looking into your baby's mouth. A tongue tie is more than just about anatomy. It's about function. If your baby's tongue can't move, your baby will struggle with effective feeding. So in this next section, we want to talk about signs and symptoms of a tongue tie and how you know if your baby might have a tongue tie. Here are a couple of signs and symptoms to watch out for. 1. Your baby has feeding difficulty. Baby has a poor latch or makes a clicking sound during nursing. Baby releases the breast frequently, or the entire feeding process just takes a long time. In addition, if baby seems irritable or fussy or is arching their back or refusing the breast, you know the baby's having difficulty. In some mild to moderate cases, early intervention and oral exercise can help to improve the function of baby's tongue enough to avoid the surgery. So here are a couple of parent-friendly techniques that you can use. 1, you want to do lots and lots of tummy time. Tummy time helps to build core, trunk strength, neck strength, and support oral motor control. You can do some cheek and lip massage where you gently rub the insides of baby's cheeks and the upper and lower lips to desensitize them and help to activate those muscles. Let the baby suck on your pinky finger while providing a little bit of resistance to improve the way baby latches on and improve their sucking skills. You can use a clean finger, put it in baby's mouth, try to guide baby's tongue to follow your finger and move the tongue up and down. Of course, you always want to consult a pediatrician before starting any kind of oral motor work or a lactation consultant. So let's talk about recovery after a frenotomy. If your baby needs a frenotomy, which is a simple in-office procedure where they release the tongue using a laser, it's a very quick and very low-risk surgery. You should be in and out in like 15 minutes. But here's what to expect during the healing timeline. Immediately after the surgery, for the next 1 to 2 days, baby will have a lot of pain and irritability. It can sometimes last as long as about 12 days. But the entire process of healing should be finished within about 14 days. Some things that you can expect: your baby should improve with their feeding immediately or in at least 2 or 3 days after having the frenotomy. Of course, you always want to follow your provider's guides, and if they want you to do some exercises, do those exercises. Some providers recommend some stretchings for baby's tongue. When I had my son's tongue released, they had me stick my big thumb in his mouth under the tongue and move it side to side to make sure it did not reattach itself. If this video helped you in any way, give it a like and subscribe to the channel so that you can get more content like this, which I'm always providing. If you have any questions, drop them in the comments below. And of course, you can also share your experiences with a tongue tie and if you had the surgery or if you didn't. Thank you so much for watching. Take care.